to use a cannula. And as you know, a cannula is a blunt straw, or like a needle that's very rounded, so it doesn't like bruise. So essentially it can't pop a balloon or anything. It's just very soft without causing as much trauma. So that way we're able to place product where I needed to place it. We're able to go to different depth and not really cause any trauma as much. So I was able to put an entry point right in here, so that way when I use cannula, I can go in here and I can fan out to this region of the lip, as well as to fan out down here with the same entry point. So I literally gave her 2 entry points and dissolved her whole lip in less than 10 minutes. To go ahead and dissolve someone's lip, that would be the best route, because when you do an entry point with cannula on the lateral oral commissures, it does allow for multiple entry points. And sometimes people find that cannulas can be a little bit uncomfortable, so it definitely helps to do an overall nerve bath wash to the lip, so that way it's a lot number throughout. I do find that topical numbing doesn't quite cut it sometimes, but if your patient has a really good I would say pain level, that's fine too. It doesn't hurt to add a little bit of lidocaine to a few spots of the lip, and then I went in after with the Hylenex, so that way her mouth is already numb, and then I can go in and painlessly inject that product as to the depth that I need to dissolve that filler in that area. It's deep enough that you can see the imprint of the cannula, as well as being able to feel where the ball of the filler is, to implant the filler, or to implement the Hylenex in that area. And then at the end, I just gently massaged it through, so that way we can have even distribution of that filler, or of that Hylenex. And with Hylenex, it does start to work rather quickly. So within 24 hours, she's going to see her lips get, and I would say noticeably softer. And even by the end of the appointment, she was able to notice that it's gotten softer. And we'll revisit in 48 hours how it feels and how it looks if we want to do a second vial. So usually you want to dissolve 1 vial at a time when it comes to lips. So that way we can see how much more dissolving we need to do to get the results we're looking for. This is not an emergency situation. We're just dissolving product to give a better look. I did an entry point in the lateral oral commissures, and I went down to the wet dry border for the top lip and the bottom lip with a 22 gauge 2-inch cannula, because we can reach multiple points to the lip. And then I numbed that by putting some lidocaine down by the infraorbital nerve right in here that does innervate these nasal arteries in these areas as well. So
if you guys are interested in seeing how I do any of my treatments, feel free to check out my Patreon and reach out for any one-on-one hands-on that you guys want to have for injector training or patient consults, and I'm here to talk to you soon.